Hello, everybody. Welcome to another episode of What's Next After BDS. And today I have with me Dr. Swathy, my junior from Sri Ramachandra, Chennai. And currently she is practicing in Dubai. Hi, Swathy. Can you please give a short intro about yourself?
Hi everyone. So I'm Swati. So I currently practice in Dubai. I did my BDS from Sri Ramachandra University, Chennai. So I'm currently practicing in Dubai now.
Fantastic. So, almost all over the world, whichever country you want to practice in, you need to clear the respective license exams. So, comes under a lot of other countries, what is known as UAE, United Arab Emirates. So, is the process similar or does it vary from country to country? You can focus more on Dubai since you've already done that and just give a brief, details about the other countries also.
So basically, since I'm working in Dubai, I'll just like explain more on that. The
Okay.
thing is, like in UAE, so for all the Emirates, you've got like around three exams. Basically, you have to give there are three types of exams. So one is a DHA, that's like only that is to practice exclusively in Dubai.
Okay.
And for Sharjah and other Emirates, that is like Ras Al Khaimah and Ajman. So all these Emirates, you'll have to give MOH exam. And then for Abu Dhabi, to practice exclusively in Abu Dhabi, you have to give HAD exam. It's HAAD. It's HAD
Can you
exam.
expand all these DHA, whatever you just said?
So all these are basically
No,
how
no,
do I
I
say
mean
the
the
thing?
abbreviations. I mean the abbreviations.
Abbreviations. I'm not sure of the abbreviations
Okay,
exactly.
okay,
DHA is basically Dubai Health Authority exam,
okay,
and MOH is Ministry of Health.
okay.
MOH, Ministry of Health. And then for HAD, I'm not sure about HAD because
No
it
problem,
was
no problem.
previously known as DOH.
Okay, okay.
I think it's department, yeah, something. Yeah, I'm not sure of that. Yeah.
So
So
how do
yeah,
you
so
go about these exams and what is the preliminary requisite?
so for DHA, there's an eligibility criteria for all these exams.
Okay,
So if you're someone who has actually cleared BDS, and then so for that you will definitely need to have 3 years of experience post BDS.
oh, okay.
Post BDS, 3 years of experience is a must. Yeah, to
When you
actually
say
sit for the
experience,
exam.
is it okay if you have worked in a clinic or it should be in an institute?
You should have actually worked in a clinic, yeah. If I'm
Okay,
not wrong, yes, in a clinic,
okay,
yes.
okay,
That
okay,
is, I mean, 3 years, that is like, there's 1 year of internship,
okay.
for 1 year of internship plus 2 years of clinical experience.
Okay, so for somebody coming from India, it's 1 year of
Yeah.
internship plus an additional 2 years.
Yes,
Okay,
plus additional 2 years. That's just that for BDS graduates. But for those who are like for MDS graduates, you need to have 3 years post MDS.
okay,
3 years post MDS, 3 years of experience.
okay,
Yeah, so this is how it is. This is the eligibility criteria.
okay.
So once you're okay with this, once you're done with all this, then the next step is you will have the data flow process. Data flow process is basically the verify. That's a verification process. It'll be basically done by it's a primary source verification process that will be done by another different agency. You can either give it to an agency to do that for you,
Okay.
or like and even you can do it yourself also. Like there's basically a website called Sharian Portal.
Okay.
Sharian portal, so where you have to like create an account for yourself, and then you can log in with those credentials. And then once you enter into the portal, you'll figure it out. You will know how to like register. You can do the registration part yourself. If you
Okay.
want to do it yourself, you can do it yourself. Or if you want it to be done by some agency, like you can just do it that way also. Like there are n number of agencies who will actually help you out with this,
Okay.
like for the data process. And
Okay.
that's the next step. Okay, then the next step is exam booking, exam booking. So then after this, you'll be like basically booking for the exam. You can like choose whatever date you're like comfortable with. You can just choose that, and then these are the three steps basically. Yes.
Sorry to interrupt. Like, how long does this verification process take place, and what is the frequency of the exams, and
Yeah, yeah. So
what
one
is
thing
the
I
exam
forgot to
pattern?
mention. Yes, one thing I actually forgot to mention is like the data flow. Like if you want to actually give the exam and then go for the data flow, you can go that way also. Like it's like you can do it parallelly.
Okay.
Like the thing
Okay.
is, yeah, you can do it either way. And regarding like the exam, like like the thing is like regarding the exam booking and everything, you can either, as I told you before, you can give it an agency or you can do it like through the Sharian portal that I spoke about
Mm-hmm.
earlier. You can do it either way. But the thing you have to make sure is like one thing is like if you're planning to give the exam, like you are planning to actually give the exam, then first give the exam and then go for the data flow.
Okay.
Or
Okay.
you can just, first you give the exam and then go for the data flow like parallelly. But make sure you're doing it parallelly. Just don't just give the exam and sit back there and just like, be like, okay, the data flow go on its way. No, it's not like that. You have to give the exam and then parallelly you should give for the data flow also. Or you can go for the data flow first and then you can give the exam. But it should be done.
Hmm.
Yeah. So you should get a positive response from the like after the verification process. Only
Okay.
then you'll be able to sit for the exam if that's the case. Otherwise, you can do either way. Yeah.
Okay.
So and it'll take almost about a month, like for the
About a month.
data flow process. About a month, yeah.
And
Almost a
the
month, yeah.
exam pattern and what or how did you study? And is there anything additionally books you had to refer or something? And how much time
Basically,
did you take for the exam preparation?
so for the exam preparation, I think I took about like around 2 months prepare for the exam. It depends from person to person. So I actually studied from a portal called the e-dental portal. So I referred that. It was really helpful because they had all the explanation plus for explanation for all the answers and everything, and they even had those mock tests also
Okay.
conducted. Yeah. And so it was actually helpful. So that is one thing I would recommend if there's anyone who's planning to take up this exam. It's actually good. And then like you can even like I was you can even go through these Facebook groups. One Facebook group which I was part of was the Crack Dental. It was
Okay.
good because they used to like those who were actually like preparing along with us, they would actually post all the past question papers and everything.
Okay.
So
Okay.
yeah, a few people they even volunteered themselves to actually create a WhatsApp group, like study groups.
Okay.
Yeah, so
Okay.
you could discuss among yourselves, and it was yeah
Okay.
that way. That's how I prepared. Yeah,
And the exam format?
format is basically it's an MCQ with around 100 to 150 questions, and the pass percentage was 60% before, but now actually they have changed the blueprint.
Okay.
I think now it's the weighted scoring system. For DHA is actually the weighted scoring system. That's like I think it's like for the restorative dentistry, you should score around 60% and above. Then
Okay.
you're considered pass.
Okay.
Yeah, and it's something like that. Like it's like operative dentistry plus prosto plus implant dentistry. All these three together, I think you should score around 60 and above. Yeah, something like that.
You
Yeah.
have separate sections in your examination. So is it something like where they focus more on clinical aspects and or there are also going to be no questions from the basic sciences?
No, there will be questions from the basic sciences, but they would focus more only on clinical. More
Okay.
on clinical. 90% would be from the clinical. They will actually have clinical scenarios and they will expect you to answer that. So I feel they're actually assessing your clinical skills more than the theoretical knowledge of yours. Basically the clinical skills.
Okay.
So
Okay.
90% would be from clinical. Yeah.
Any practical sessions or Viva sessions? After that, it's going to be only theoretical.
No, no practicals. As of now, no practicals, but previously they did have practical exams conducted.
Okay.
But right now, no, they don't have any practicals. It's just purely prometric MCQ based online exam. This is actually a prometric online exam.
So you get to write
Yeah.
it from your home or you need to go to any particular center?
No, you should go for to a prometric center where you'll be writing.
You have
Yeah, and
centers
it's
in
a
India?
2.5.
You have centers in
Center,
India?
you have centers in India too. Yeah, you have centers in India. You can actually take up the exam from anywhere,
Okay.
any part of the yeah. You can You
Okay.
basically just need to go to a prometric center and take up the exam. That's it. And it's for 2.5 hours. The
Okay.
exam is for 2.5 hours. No negative marking. Yeah.
No negative marking.
No
So
negative
this
marking.
is it with respect to DHA. So if you're going to
Yeah.
practice in Dubai, you just need to clear the DHA, right? And
Yes,
once you
just
clear
yeah.
the DHA, are you allowed to do like all sort of procedures or it's only GP procedures? Do you have any
Uh,
restrictions on what procedures you can do and what procedures you cannot?
Actually, there are restrictions. Like
Okay.
you can take up all general dental procedures, but some complicated procedures. I mean, like you can't do implants.
Okay.
You will have to take up separate exam for that. Or
Okay.
you must be like specialize in implant dentistry, or you must be a prosthodontist or something to actually take up that exam. But even if you have taken up a course back in India, I mean, like if you have taken up an implant course, you will have to take an exam here. And from what I've heard, You'll have to take an exam, plus you will have to even show all the cases and everything. I think some 30 cases or something, you should be having that in your hand. You should be showing something, yeah. So I'm not sure of that, yeah. But then you need to have that. General dentists can't practice here. Like they can't do implant here unless and until they clear an exam for that.
So is it okay only
Plus,
orthodontist? Okay, yeah, please tell me, please tell me.
yeah, no, plus even the impactions, like all the not
Surgical base.
impactions, I think even yeah, surgical impactions, like you should have done a course. Yeah, you should have done a course.
Okay. So if somebody with a post graduation comes to Dubai and writes the
Hmm.
DHA exam, so they are allowed to practice their specialty.
Yeah, they are allowed to, but you have to take up. Yeah, so regarding that, like general dentists should take up only general. That is, I mean, like if you have only cleared BDS, like if you've done only BDS and no post graduation, you're supposed to take up the general dentist exam. That is a different exam. Now, if
Okay.
you have done like a specialty, then you can take the specialist exam.
Okay.
So there
Okay.
is like certain things. So you can only like if suppose you have done only the general dentist exam, you can like only like do general dental procedures and be a general dentist. You
Okay.
can't be a specialist.
Okay.
But there are actually a few specialists who actually take up general dentist exam and then they practice as a specialist too. There are a few clinics who actually allow you to do, even if you are, a specialist and you can just do all procedures also. You can even like do your specialization too in that clinic. But certain clinics won't allow you to do that. And if you are under the general dentist license,
Okay. Okay.
they won't allow you to do that. Yeah.
And you were talking about two other exams in the other part of the UAE. How does that work?
You mean MOH and
Yeah.
HAD?
Yeah, for
Yeah,
Sharjah,
MO
for
that is MO is also exam. The pattern is almost similar, except that you will have like I think the probably the I'm not sure of that. Actually, MOH I've heard that it's pretty tough. Like when compared to DHA and HAD, it's pretty tough.
okay. And you
Yeah.
need to clear all the three exams for those practicing there. Okay. It's only for,
Yeah, yeah, you have. No, you don't have to give all the exams. As I said, like with Dubai, if you're planning to practice only in Dubai, then you have to take up DHA. If you're planning to practice in Sharjah, Ajman, and Ras Al Khaimah, other Emirates, then MOH is okay. You can go for that. And if you're planning to practice only in Abu Dhabi, then you have to take up HAD. But that's how it is.
okay. Okay.
And one more thing, sir, yeah. And one more thing is you can even transfer your license. So suppose you have taken up DHA, but you're planning to shift to Abu Dhabi, or if you're planning to shift to Sharjah, you can actually transfer your license
Oh,
in 6 months' time. Yeah, you can do that. Yeah, you can even do that. That is
only in
also
the
an
first
option.
6 months. After that, it's not possible. Once
I
you
know after 6 months, 6 months of experience in Dubai. If suppose I've actually worked in Dubai for like around 6 months and I plan to like move to Sharjah or something, then after 6 months you can transfer
so currently you
to
have the
MOH.
eligibility of what do I say? Opening your own practice in Dubai because you've cleared the DHA, right?
Yeah, you can open up your own practice, yeah.
Not like
But only in Dubai if you have done
okay, only in Dubai, only in Dubai. Okay.
only in Dubai. Yeah. I mean,
And
if you have done DHA alone.
okay, and now that you're a general dentist, suppose you want to do a post graduation in Dubai itself, are you allowed to do
Mhm.
now, or is there any restrictions or something like that?
No, you can do it, but I think you need to meet certain criterias for
Okay.
that.
So, for example,
Yeah.
in India, we write the NEET exam, and based on your rankings, you get into the department and college of your choice. How does
Mm.
getting into a post graduation degree or college there work? Do you have any?
Uh, Over here, actually, over here, we don't have an exam. We don't have to take up an exam. But the thing is, I think you need to have your IELTS plus, I think or whatever it is, like the exam, like pertaining to that emirate, you have to take that up also. Yeah, that is one thing. And there are certain
Sorry, I
criteria
think
too. Yeah,
you broke there. Can you just repeat what you just said? IN?
IELTS. IELTS, IELTS,
IELTS.
IELTS,
Okay, okay,
IELTS, IELTS,
okay,
IELTS.
okay.
Yeah, you have to meet, yeah, you will have to clear that. Plus, then you have, then I think you need to have some experience, I guess. I don't know. I'm not sure of that actually. But you can actually, yeah, take it up here. But it's pretty expensive. Like the
Pretty
post-graduation here
expensive.
is pretty expensive when compared to India. Yeah,
Okay.
it's actually a lot of expensive. Yeah, it is. That is one
Thank
thing.
you so much. And is there something you want to add on for people looking to practice? Is there something which which they need to know, which I haven't asked on? And how much is the approximate cost of this exam and, getting your license there and all that?
So, like for the data flow, it will cost around 42 to 43,000 data
Okay.
flow. That's a separate charge. And for the exam booking is a separate charge. It'll come around 22 to 23,000.
Okay.
Yeah, exam booking.
And the frequency
And
of the
then,
exam, how is it, like monthly ones or once in 3 months, something like that?
you mean like, sir? Yes,
In the
pardon?
DHA
Like,
exam, how often does it come? Like in how
that one, yeah, every month you can take it up any month. Like you can
every
just take
month?
it up
Every month.
whenever you want. And one more thing is this exam, you got only 3 attempts for this exam.
Okay.
Only 3 attempts, yeah, for this exam.
Okay.
Be it a DHA, MOH, or HAT, only 3 attempts.
Okay.
And then the DHA, like once you get the DHA license, it
Mhm.
will be valid only for a year.
Okay.
Yeah, it'll be valid only the exam. You get an eligibility letter once you clear the exam.
Okay.
That letter will be valid for 5 years, but you need to like once you like you'll have to find a job within that 1 year time period because it's like valid only for a year. If you get the license, it'll be valid only for a year.
But if you're
So you'll
going to
have to find
practice all by yourself, that also is counted, right?
You mean like if you're planning to establish a clinic of your own?
Yeah. Yeah.
Oh,
That's
in that way, it's fine. Like, yeah, in that way, it's fine. Yeah, that's a different scene altogether. Like,
So
yeah.
you said you need to find a job within a year, right? So I was just wondering,
Mm.
like, if you're going to set up your own practice, does that still hold good?
If you're planning to set up your own
I
practice,
know it's going to be really expensive and all that, considering the.
yeah,
Okay.
it is. Yeah, it is expensive. But then, yeah, you can. But then it takes time.
It takes
Actually,
time.
like establishing a clinic, yeah, it's not that easy here. Like,
Mm-hmm.
the thing is like most of and one more thing over here is most of the clinics, they don't offer you like salary, like,
Mm-hmm.
like,
Okay.
yeah, they don't, most of the clinics are nowadays, they're not offering basic salary, and most of the clinics, they offer just like, like, this, they actually run on this profit share. They basically offer only profit sharing basis, like, for the dentist. Yeah. That's
Okay.
how it is. Like on the percentage basis. It depends on how many cases you do, and yeah, depending
Oh,
on that.
okay. Okay.
Yeah, that's how you actually earn here. Most of the clinics they do that, but there are a few clinics, few established clinics who actually do offer you a good amount of salary. But right now, situation here, it's like pretty saturated here. It's pretty saturated here for
Mm-hmm.
dentists. Yeah.
Okay.
So especially for those who are planning to like move to Dubai, you must know that. You must have that in mind. Yeah,
Okay.
that
Okay.
is one.
I think it's
Mhm.
pretty much you have to find your own way everywhere else. Wherever you go, there's going to be a huge crowd, but still you have to do something different
That's
to,
true.
stand out.
Yeah.
Thank you
If you
so
have
much.
some contacts, then it's good. If you have contacts, then it's good. If you have contacts,
Contact.
then
Okay.
it's good. Yeah, it'll be good. Yeah.
Thank you so much for your time. And is it okay if I can share your ID at the end of the video so that if somebody wants to
Sure.
approach you for something, they can
Sure.
reach
Sure.
out to
Yes.
you? Yeah?
Sure. Yes. Sure.
Okay.
Yeah.
Thank you so much, Swati. Have a great day.
Thank you. Thank you.
Dr. Swati, can you please tell me, like, what are the documents required for the verification procedure?
Yeah, so for the verification procedure, they would basically ask you certificate, then the good standing certificate from your dental council. Yeah, so these are the documents that will be basically asking you.
Can you just repeat? I think it got stuck
You
again.
need to submit all
So,
of this. Yeah,
can you repeat those documents? I think
yeah,
I just switched
yeah,
off the video for a better connectivity.
yeah,
Can you repeat? Yeah.
sure. Yeah, so basically, for the verification process, we'll have to submit your degree certificate, then your experience certificate, and your good standing certificate from your dental council. So these are
Okay.
documents that you should have in hand.
Okay. Okay.
You need to like submit a CV also. Yeah.
Yeah, that is mandatory, of course.
Yeah.